So I'm going to hand over to Tan now for his talk. Thank you, Tan.
And good afternoon, everyone, and thank you for being here. I'm Tan, and today I'm very excited to kick off my presentation about forecasting malnutrition-driven health service demand in Kenya using long short-term memory networks and multi-short time series data. And to guide you through the next 50 minutes, I will start with the motivation behind the project, why this work matters. And then I will give you a brief overview about the dataset that I have been working on, and the long short-term memory models, and then the planned future work. And as usual, we will have a short Q&A section at the end, so please jot down any questions as we go. Okay, let's start with a number that's hard to ignore. Nearly half of deaths of children under 5 related to undernutrition, malnutrition, and stunting reflection of chronic undernutrition affects about 149 million children globally, and in Kenya, nearly 1 in 5 children under 5 suffer from stunted growth. It's not just a statistics, but a reminder that behind every number in a child's life could have been different with better access to nutrition and care. And I believe that no one can understand better the situation in Kenya than its own people. And that's why I have been studying a lot of national report on food and nutrition security, especially for the long-range and short-range assessment report in Kenya. And these assessments just review how interconnected the driver of food insecurity are, and using and for example the climate variable and conflict to the economic shocks and displacement, and using the data from these interconnected and challenges, we can help to support more informed planning and response in health service demands. And now we have seen the motivation behind the projects, and here is the brief overview about the tasks that actually involved in the projects. First, I need to collect the draw data from multiple sources. It provides us different pieces of the bigger picture, and then the draw information will be analyzed, cleaned, and combined into a single time series data, which is something consistent structure and ready for modeling. And then using that data set, I will build the LSTM model to forecast the emission rate. And finally, the performance of the models, the prediction needs to be evaluated and analyzed. Yeah. And here's on the table, you can see the list of 10 different data sets that I have been explored so far. For example, the rainfalls and the temperature. Actually, in Kenya, about 89% of Kenya's land is arid and semi-arid, and combined with the rain-fed agriculture. That means Kenya depends a lot on rainfalls, but the rainfalls can be a double-edged sword. While it supports agriculture, it also causes flooding in many parts of the country, causing the displacement of communities. Another example is the nighttime light at the row number 6. Is satellite data measure the light emitted from the Earth's surface at night. It can reflect levels of urbanizations, economic activities, and even displacement, such as after a disaster or a conflict, for example. And one of the interesting findings so far is that the correlation between the input feature and the emission rate is vary significantly from one county to another. On the screen, you can see two matrices for correlations for Marsabit county and water counties. While in both cases, you can see that the emission for the previous months related a lot to the next month rate. That is something we would expect to for time series data. And meanwhile, in Marsabit, we can see that the price for the white maize and the NGVI would measure the vegetation health heavily related to the emission rates. While in water, we can see that IPC, which is Integrated Food Security Classification, and the nighttime light intensities heavily related to the output, the emission rates. And that also means that each county needs a different set of data for accuracy predictions. And the one-size-fits-all model may not work well for all the regions in Kenya. And here is another method that I use combined with the Pearson correlation, which is Chugh, which gives us a model-based perspective on how the feature contributes to the output. And using these two methods, I can reduce the number of features and create a tailored set of input for each counties, which help to reduce the noise in the data and improve the accuracies and stability of the LSTM model. Another chart that shows us the frequency of the selected features. The y-axis shows the list of features, while the x-axis shows the number of counties which selected the features. And you can see that on the top are the 4 features that's consistently important for all the counties. And and move down a bit, you can see more features that are more location specific for the county. Okay. And let's move into the section on long short-term memory models. Yes, it's just a type of a recurrent neural network that works well with time series data. Yeah. And using the cell and gating mechanism, the LSTM network helps to retain important information over time and help to improve the accuracies of the model. And for the main targets of building the model is to forecast the emission rates for 1 month, 3 months, and even 6 months ahead of time, supporting planning and response for health service facilities in Kenya. And to improve the prediction accuracies, I use Bayesian optimization to fine-tune key hyperparameters. And for comparing the prediction accuracy across all the models, I use the root mean square error to compare for the model for different counties and also different forecasting settings. And here is a sample for the Marsabit counties. The blue lines is the actual trend data. The red one is for the test data, and the green one is the predicted from the model for the same time period. You can see that, to be honest, the predictions are not perfect yet, but I believe that it managed to pick up some trend, overall trends in the hospital admissions in Marsabit. And this is another example for water counties. Again, I think it's a little bit better than the last one, but there are 2 certain drop in admission rates that need to be more investigations. Okay. And I also create animated maps for Kenya to show the reductions and the actual emission rates. On the left is the reduction, on the right was the actual value. And you can see that the map will fast forward through time from 2017 to January 2020. And you can see the difference between the reductions and the actual. Yeah. So, what do you think? Yeah. And I think although the early results are promising, I believe that there are still more to do and explore. There are 5 main things that I will do after the conference. Yeah, I need to develop more data sets and models to cover for all the counties in Kenya. Actually, there are 47 counties in Kenya, but for now I just have about 17 counties covered due to the availability of emission data. And I also want to expand the forecast to 3 months and 6 months horizon. And also, I would like to evaluate the impact of the latitude features on model performance. For example, the effects of flooding or a conflict events may not appear immediately, but weeks or months later, and that will affect the model predictions. And the last 2 things is identify and iterate more relevant data sets like the drought events or the disease outbreaks. And finally, I need to make sure that the models will work in the real life. So I need to put more care on analyze and interpret the model output and also the feature contribution analysis. And that's the end of my presentation. Thank you for listening.
Thank you so much, Tan. Does anyone have a question in the audience for Tan? Okay. Oh, yes. Okay. Thank you.
So in your slide, the time series, doing
Yes.
predictions, retraining, and forecasting, it looks like you have far more variability in your training data set than what you're trying to predict. That's what I wanted to before. There's a lot of variability in your training.
Yeah.
The bit you're trying to predict didn't have so much variability. That's why it's poorly fitting.
Yeah. Maybe that's, that can be affected from the missing of all the relevant data. And in the future, I and my team will work more on exploring more factors that affect the malnutrition and also the admission rates in Kenya. And I hope that will be more accurate.
Something else you could do, you could try to predict something you already know, or backcast, see if that performs any better.
Sorry, can you repeat?
Try to predict what you already know. To backcast at the start of your time series, try to predict at the start of your time series and use training from the rest of the time series as your training data set, so go backwards.
Yes, yeah, that's a good point, and we try it. Yeah, thank you. Please.
Okay, yeah, question in the front here.
If you became very good at forecasting which counties might have greater malnutrition, how might you then communicate that to people who do something about it? What might the end user of your system be? Who might be the stakeholders be? Who could
Yes,
then
maybe
react?
just show them a map of Kenya, like I showed you before, or give them the number of the forecast emission rates. Yeah, there are some different needs in the health workforce that we need to, but for now, we just focus on the emission rate. So we can plan the support, plan the resources to support the country that are in need. Yep.
Okay, thank you. I'm slightly conscious of time, so I think we should move on to the next speaker.